In the previous lecture, we discussed acute myeloid leukemia, but now we will discuss the chronic myeloid leukemia. So without wasting time, let's get started. Again, we will look at the blood cell lineage. So it starts from the hematopoietic stem cell. It has two lineage, common myeloid progenitor and the common lymphoid progenitor. And from the common myeloid progenitor, you will see the three lineage, megakaryoblast. It will result in the formations of the platelets. Proerythroblast. It will result in the formations of the red blood cell. And the myeloblast. From the myeloblast, you will see the formations of white blood cell through the different lineage. So it starts from the myeloblast, then result in the formations of the promyelocyte, myelocyte, metamyelocytes, band form, and ultimately you will see the formations of the neutrophil, basophil, and eosinophil. Along with that, you will see from the myeloblast, you will also see the formations of the monocytes. So all these are white blood cells. But the difference is neutrophil, basophil, eosinophils are granulocytes, while the monocyte is a granulocyte. So common myeloid progenitor forms the platelets, red blood cells, and the white blood cells. But the defect starts in this myeloblast. You will see the proliferations of the myeloblast, and ultimately you will see the myeloblast number in the bone marrow starts increasing, and it can also affect on the megakaryoblast and the proerythroblast lineage. But important thing, in the acute myeloid leukemia, you will see the increase in the number of the myeloblast. But in the chronic myeloid leukemia, you will see the differentiation happens in that case. While in acute, there is no differentiation or minimal differentiation. But in that case, you will see the differentiation, and ultimately you will see the high number of the neutrophil, basophil, like this one. So that is the important thing about the chronic myeloid leukemia. Next, cause of the chronic myeloid leukemia. What genetic mutation you will see in that case? So you have to understand the Philadelphia chromosome, which is the main reason of the chronic myeloid leukemia. So you have chromosome number 9 and the chromosome number 22. Chromosome has two arms, P arm and the Q arm. Similarly, chromosome 22 also have P arm, that is the smaller arm, and the Q arm, that is the larger arm. And you will see at the larger arm of the chromosome 9, you will see a gene, that is ABL gene. Okay. And at the chromosome number 22, you will see the another gene, that is BCR. Now, you will see the translocation of the APL gene from the chromosome number 9 to the chromosome number 22. In that case, you will see ABL gene removed and it will go towards the chromosome number 22, and fusion of the ABL BCR gene. That is the important thing, fusion of the ABL BCR gene. And ultimately, what will happen? It activates the production of abnormal tyrosine kinase, and the tyrosine kinase ultimately enhance cell division, high proliferations of the cells, reduce or inhibit the apoptosis, cell death, and ultimately you will also see the myeloid proliferation starts increasing. All these factors goes in favor of the cell proliferation. So ultimately myeloblast starts proliferating and ultimately differentiate into the neutrophil, basophil, and eosinophil. So that is the important thing which you have to remember about the Philadelphia chromosome. This chromosome number 22 having both fusion gene ABL BCL is called the Philadelphia chromosome, and ultimately you will see the activation of the tyrosine kinase and ultimately cell proliferation in that case. Next, epidemiology. It is common in the adults, most probably between the 45 to 60 years of age people. slightly more common in the male as compared to the female. Next, we will look at the phases of the chronic myeloid leukemia. You will see three phases: chronic phase, accelerated phase, and the blast crisis. In the chronic phase, you will see less than 10% blast, but we see in acute there is greater than or is equal to 20% blast. In the accelerated phase, you will see the 10 to 19% blast and large number of basophil. In normal CBC report, basophils are too much low. But in that case, you will see basophil starts increasing in the accelerated phase of the chronic myeloid leukemia, CML. And in the blast crisis, you will see the 20% or greater than 20% blast. It will just similar to the acute myeloid leukemia, because in acute myeloid leukemia you will also see the increase in the number of the blast like 20% or greater than 20%. In chronic phase, you will see the fatigue, weight loss, fatigue due to the anemia, splenomegaly, bone marrow, and the gout due to increased cell turnover, gout, accumulations of the uric acid in the joints. Accelerated phase, you will see the anemia, severe anemia. That is the most important. Severe splenomegaly, bleeding, and the infections. Bleeding due to the platelets disturbances and infections due to the white blood cells. Next, in the blast crisis, that is the progressive leukemia. We face lot of problems in treating this phase of the CML, that is the blast crisis, and severe symptoms you will see in that case. In the diagnosis, you will see peripheral blood smear, you will see leukocytosis, that is greater than 1 lakh per microliter, but the normal WBC count is the 4,000 to 11,000 per microliter. It's too much high. Platelets will also be increased, or it can also be normal. Bone marrow, you will see the hypercellular due to the increase in the blast cells. And the myeloid to erythroid ratio will also be increased, because if we look at the ratio myeloid to erythroid ratio, because it's a direct relation. If the myeloid cells increased, then ultimately ratio will also be increased, because myeloid and the ratio will be in direct relation. Next, in the cytogenetic, you will detect the Philadelphia chromosome. That is the important thing, which is the chromosome number 22 having BCR-APL gene. Molecular, you can also go toward the molecular test, PCR, and the FISH. FISH is also a technique, hybridization technique. In the treatment plan, you will see the targeted therapy. You have to block the tyrosine kinase, because tyrosine kinase starts proliferating or give instruction to the proliferations of the cell. So we have to stop the tyrosine kinase inhibitors. In that case, you will see the imatinib, dasatinib, nilotinib, and the bosutinib. So these are basically the different tyrosine kinase inhibitors. That is the targeted therapy in that case. You can also go toward the hydroxyurea. It is given before the tyrosine kinase inhibitors therapy. And you can also go towards the stem cell transplant in severe cases like in the blast crisis phase, because it's very difficult to treat this phase of the chronic myeloid leukemia. So this is all about the CML. If you still have any question, you may ask in the comment section. Thank you so much.